So can HRT or oral contraceptive pill increase breast cancer risk? So to answer that, it's important to understand the impact of hormonal changes on breast tissue. Different hormonal exposures over the course of a woman's lifetime has an impact on her breast cancer risk. So pregnancy and breastfeeding reduces the total number of lifetime menstrual cycles and therefore exposure to certain hormones which are associated with breast cancer. So multiple pregnancies, breastfeeding, and breastfeeding for longer are protective. Going through puberty early or a late menopause or never being pregnant increases the lifetime number of menstrual cycles and again, conversely increases that risk of breast cancer. Now, with oral contraceptive pill, there is a small increased risk overall, but it's estimated that less than 1% of all breast cancers in the UK are related to oral contraceptive pill. The risk is also proportionate to the duration. So being on HRT for 5 years, oral contraceptive pill for 5 years increases that risk by about 7%. Being on it for 10 years doubles that risk. Also, the risk reduces after oral contraceptive pill has been stopped and returns to the same risk as a non-user after about 10 years. The risk is related to the type of preparation, so whether it's a combined estrogen and progesterone pill or whether it's estrogen only. Overall, the risk is only about 1 in 700 risk, which, as I mentioned, is only about less than 1% of all breast cancers. So it's important to consider your particular situation and discuss that with your GP. And of course, people are on oral contraceptive pill, not just for contraceptive use, but for controlling heavy and painful periods or endometriosis. So in your particular situation, the benefits may far outweigh the small risk. Now, in terms of HRT, again, the risk is between 1 in 50 and 1 in 200. And overall, only about 2% of all breast cancers is thought to be attributable to HRT. Again, a number of factors related to that. So the type of HRT, whether it's estrogen only or combined, and again, the duration. But it's also important to consider individual patient factors. So whether somebody may be overweight or obese, that can also increase breast cancer risk in combination with HRT. So again, it's really important to weigh up the pros and cons on an individual basis with your doctor. And let's not forget that HRT can have a protective effect in terms of bone health and on heart health. So if you have a particular increased risk of fractures or cardiovascular disease and no family history of breast cancers, then in your particular situation, then HRT may be very beneficial and again outweigh that small risk. So alcohol is a big one. I always find it surprising how many of my patients actually weren't aware that alcohol could be a risk factor in terms of breast cancer. In the Million Women study, which was an observational cohort study conducted by Oxford University, they followed up nearly 700,000 postmenopausal healthy women over the course of a decade or so, and they looked at various dietary links that could have increased cancer risk, and the strongest link was with alcohol. Alcohol causes DNA damage and also increases in estrogen and other hormonal levels associated with breast cancer. And in breast cancer survivors, so these are people who've had breast cancer, we know that alcohol can also increase the risk of a recurrence. And even as little as 3 units a week or 3 small drinks a week could increase that risk. Now, of course, I'm not suggesting that everyone needs to give up alcohol completely, but it's about making an informed decision. Diet is something that I get asked a lot about, and it's important to consider what we eat, but also when we eat it. So in terms of what we eat, plant-based diet, ideally with plant-based proteins in every meal is very important. Keeping your meals varied and colourful, really avoiding or minimizing processed food is really important, and increasing roughage. Cruciferous vegetables such as cauliflower, kale, broccoli, those are all been shown to be very helpful and reduce cancer risk, as well as fermented foods such as miso, kimchi, and kefir. Antioxidant foods are those rich in color, so peppers and brightly colored berries and fruit, but really keeping it as varied and minimizing processed food and processed sugars in particular. With regards to sugars, I get asked a lot about sugar and the impact on cancer and cancer risk, and it's not so much about cancers feeding off sugar, but it's your body's response to sugars or highly processed food that can stimulate an environment, create an environment that could stimulate cancers. So it's important to consider foods that are low in glycemic index, that can release energy slowly and maintain a healthy blood sugar levels. In terms of when we eat it, there is an increasing body of evidence for intermittent fasting or time-restricted diets. So really considering when you eat your meals and having a period of fasting, which would involve avoiding any calorific foods for that period, but maintaining your fluids unlimited. This has been shown to have many health benefits, including reducing blood pressure and blood sugars, lowering cholesterol and weight overall, but also some evidence to suggest that it could stimulate your immune system and reduce stress levels. So lots of health benefits across the board. And of course, maintaining a healthy weight with a BMI of less than 25 not only reduces your overall cancer risk, but also your risk of other medical conditions such as strokes, heart attacks, dementia, and diabetes. And even if you're slim, we know that there is an additional benefit from cardiovascular exercise. So to try and maintain, to try and do some regular exercise, even if it's only for 15 or 20 minutes a day, is better than doing one or 2 hours at the gym once or twice a week.